This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're heading over to pulmonology today. Now we're going to be speaking with pulmonologist Dr. Rob Geck. We're going to be talking about something that's become quite the fad, quite the trend, e-cigarettes and vaping. Just how harmful are they? Well, thank you for taking some time with us once again. Nice to see you. Today we're talking about e-cigarettes and vaping, and just if people are familiar with it, what are those things? What is an e-cigarette?
So an e-cigarette is a relatively newly developed method of administering nicotine. And so what it is a electronic device that heats up a chemical and puts into the air, into your, really kind of a vapor that contains dissolved nicotine. It's usually dissolved in what's called propylene glycol or a vegetable kind of oil type of a product to allow it to dissolve and get in.
And vaping would be the actual act of...
Yep, and that could be from another mechanism, but generally the e-cigarettes or the look-alike cigarettes are the most common form of delivering it.
Okay, so I guess when people talk about the e-cigarettes or you see people vaping, I guess the initial thought is this is more healthy for me or not as harmful for me as a cigarette. But are they harmful?
Well, there are some harmful effects, and the hardest part is that we just don't know them as well as we know cigarettes. So the idea behind them is that you've removed the burnt, tobacco leaves, and so there is some reduction in the number of hydrocarbons and other harmful known carcinogenic items. And ideally, it should just be a safe chemical, the propylene glycol, or and nicotine. Now, there should be relatively safe. Nicotine replacement products have been around for years, and we know that nicotine in lower doses is not necessarily harmful. So the idea is that this should not be as harmful as a cigarette itself.
Is there a chance there could be any benefit to an e-cigarette?
So the benefits to an e-cigarette, ideally, and the way they were developed was to replace the more harmful cigarette. Unfortunately, that hasn't necessarily panned out to be the case. And as we are looking at these closer, we are finding that there may be more additives in these things. And so it's not just nicotine and a solvent. It is flavor additives. There are a lot of other things being added to these things. And so rather than its intended purpose as being a alternative to smoking, it's actually become kind of a cool thing to do and is starting to pick up with different generations and the younger generation. And so in the absence of any known studies on these things in terms of harmfulness and efficacy in terms of even getting people to stop smoking, it may not be the way to go at this point.
Yeah, I mean, you talk about different generations trying it. You see more and more kids thinking, kids like to try cigarettes or try something new. This might be something that kids get started with. Probably not a good thing for children to be trying.
And we've actually seen an increase in usage in the age group 18 to 25. Ideally not younger than 18 because they're not supposed to be sold to minors. However, there's a lot of buzz and talk about this, and the regulation on that is non-existent. There is no FDA control on what goes into them. There is no FDA control on any aspect of it. You can pick one up over the counter as long as you're older than 18 years old. And we have seen an increase in the usage of that. They're bubblegum flavored for a reason. Your 40-year-old, 50-year-old cigarette smoker is not picking them up for the bubblegum flavor. This is being actually targeted towards a younger generation for good reason, for marketing purposes, for money purposes. Unfortunately, there are conflicting studies that say that it might actually increase the use of traditional cigarettes, even in these younger individuals who are still prone to these, to peer pressure and other things like that.
Yeah. So probably not a good idea for children. What about adults? Even in a situation where you might be trying to quit smoking, traditional smoking, is it still all right to use an e-cigarette or try to wean yourself off on an e-cigarette?
In theory, yes, it would be better to wean yourself off on an e-cigarette. Again, we still don't know any hidden harms in there. And if you remember on traditional cigarettes, it took years to find out what they actually had in terms of harm. And so in the absence of true data on how helpful they are, or sorry, harmful they are, that it may be helpful. The idea is to wean yourself off. It should not be intended as, exactly. It should not be a replacement. It should be a method of gradually phasing it out of your system. Much the same way that we use the other nicotine replacement therapies. Nicotine gum, the patches, all those other things are designed to gradually step down, not continue for forever.
Whether you're using e-cigarettes or traditional smoking or other uses, tobacco uses, what are some of the signs that we should be looking for that might indicate that there's an immediate problem?
Well, the hardest part is as an adult or as a parent, you need to look at it in your kids and see if they're using it. There's an increase in actually nicotine poisoning, and there have been a number of reports to the trips to the emergency department for children who have been poisoned from the nicotine and have issues with cardiac arrhythmias and other irritable problems. And so that is one thing to look for as a parent in your child if they're using it. Secondly, as an adult, the idea is to begin weaning yourself off. Obviously, like everything else, if you're beginning to have chest tightness and more trouble breathing while using them, then you're having a sensitivity to the product and you should switch to something that's not inhaled.
Yeah, and I would imagine, just like with traditional smoking, secondhand smoke is always a concern. That may be an issue as well, but again, still being studied.
Yeah.
When you start looking at these studies, how long might it be before we start seeing some hard data as to how harmful, not if it's harmful, but how harmful this e-cigarette trend might be?
It may take years. There are studies that are currently going on that suggest that it causes irritation and inflammation of the lungs in certain individuals, and those are subtle and not robust enough to say, hey, look, this is not something we should be doing. The ones that, like in tobacco smoke, they've taken years to find the development and the production of cancer. Now, when it comes to some of the flavor additives, we have good evidence now that some of these flavor additives, when inhaled, do cause significant lung reaction. In fact, there's even a diagnosis called popcorn lung, which the butter flavoring of popcorn, if exposed to in large quantities, not just from eating it, but in manufacturers, can cause significant lung disease. It has in the past.
A lot of research still to be done, and boy, I guess it's better just not to get started.
It's better not to get started. If you are a current traditional smoker and this is what you want to do, then use it appropriately and wean yourself off of.
All right. Well, thanks for taking some time with us today.
Sure.
Now, as Dr. Geck mentioned, it's best not to get started with traditional tobacco or e-cigarettes. If you're having some problems, some of those issues that Dr. Geck talked about, you should get in and see your primary care provider as soon as you can. If you have any other questions, you can give us a call here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.